Imagine a world where colors fade, where the vibrant reds and blues of a sunset slowly turn to dull yellows and browns. This is not just a hoax, but the reality for many experiencing the mysterious and often misunderstood world of cataracts. Cataracts are not just a tale of aging. They're a diverse and complex condition affecting millions globally, irrespective of age, even newborns, also known as congenital cataracts. With cataracts, the familiar becomes unrecognizable, and everyday tasks transform into challenges. This condition, the leading cause of vision loss worldwide, holds surprising secrets and misconceptions. Did you know that Claude Monet, the renowned French painter, saw his artistic palette morph due to cataracts? Or that your risk of developing cataracts could be influenced by something as simple as the color of your eyes? So, sit tight and please watch this video to the end as I explain what cataract is, causes, signs and symptoms, subtypes, treatments, and even diets or foods that might help lower the risk. If you are new to my channel, I am V, and welcome to the best health channel on YouTube, where we talk about everything related to your health and well-being. First, we need to understand what cataract is and some facts surrounding it. Cataracts are a common eye condition where the lens of your eye becomes cloudy, leading to a decrease in vision. It's like looking through a fogged-up window. This cloudiness can make it more difficult to read, drive a car, especially at night, or see the expression on someone's face. The lens inside your eye works much like a camera lens, focusing light onto the retina for clear vision. It also adjusts the eye's focus, letting us see things clearly both up close and far away. The lens is mostly made of water and protein. As we age, some of the protein may clump together and start to cloud a small area of the lens. This is a cataract, and over time, it may grow larger and cloud more of the lens, making it harder to see. Cataracts often develop slowly and can affect one or both eyes. Now let's look at the causes and risk factors. Cataracts develop when changes occur in the lens of your eye, making it cloudy and leading to vision impairment. This cloudiness happens when the proteins in the lens clump together. Several factors contribute to the development of cataracts. Age. Age-related changes in the lens are the most common cause. As you get older, the proteins in your eye's lens can begin to break down and clump together, forming cataracts. This is why cataracts are more common in older adults, but cataracts can also be seen in newborns, known as congenital cataracts, usually due to genetics, Down syndrome, some maternal infections, or injury in the eye after birth. Genetics. Family history plays a role. If your family has a history of cataracts, you may be at a higher risk. Medical conditions. Certain conditions, especially diabetes, can increase your risk. Uncontrolled diabetes can cause changes in your eyes that lead to cataract formation. Eye injury or surgery. Past eye injuries, direct traumas to the eye or surgery can prompt cataract development. Lifestyle factors. Smoking and excessive alcohol use are significant risk factors. Both habits can alter the cells in your eyes, contributing to cataract formation, so cut down on drinking and smoking, as they are risk factors to many diseases, not just cataracts. Prolonged use of corticosteroids and other medications. Some medications, particularly corticosteroids, can increase your risk of developing cataracts. Excessive exposure to sunlight, UV rays, ultraviolet light from the sun can damage the proteins in your lens, speeding up the formation of cataracts, so try to protect your eyes with sunglasses on sunny days. You are not Superman. Radiation exposure. Exposure to certain types of radiation, such as X-rays or cancer treatments, can also contribute to cataract formation. Obesity. Higher body mass index, BMI, is linked with an increased risk of cataracts. You might be wondering how this happens. Obesity increases oxidative stress, thereby increasing free radicals in the body. These unstable elements can damage the eye over time. High blood pressure. Having high blood pressure might increase your risk of cataracts. This is because altered blood flow to the eye can damage your eye cells. Let's delve deep into the symptoms of cataracts to understand them and know when to seek help. Blurred vision. The cloudiness in the lens caused by cataracts scatters light as it enters your eye, leading to blurred or hazy vision. This is often the first noticeable symptom. It can feel like you're looking through a frosted or fogged window. Faded colors. The protein clumps that form cataracts can tint the clear lens, leading to faded or yellowed vision. This makes it more difficult to differentiate between certain color shades, especially blues and purples. Difficulty with light and glare. Sensitivity to light and glare is a common symptom. You might find sunlight or indoor lighting uncomfortably bright, or notice halos around lights, especially at night. This can be particularly troublesome when driving in the dark, as oncoming headlights may cause more glare than before. Poor night vision. As cataracts develop, they can darken with a brown or yellow tint, reducing the amount of light reaching the retina. This can significantly impair night vision, making it difficult to see in low light conditions. Double vision. In the early stages of cataract development, you might experience double vision, seeing two images instead of one, when looking with one eye. This happens because the cataract scatters the light entering your eye, creating multiple images. Frequent changes in eyeglass prescription. As the cataract progresses, it changes the way light enters your eye. This may result in a rapid change in vision, necessitating frequent updates in eyeglass or contact lens prescriptions. Second sight. In some cases, cataracts can cause a temporary improvement in near vision. This phenomenon, known as second sight, occurs because the cataract acts as a stronger lens. However, this improvement is usually short-lived as the cataract continues to develop. It's important to remember that these symptoms can also be indicative of other eye problems. Regular eye exams are crucial for diagnosing cataracts and other eye conditions. If you're experiencing any of these symptoms, it's advisable to consult an eye care professional for a comprehensive evaluation and appropriate management. Now, cataracts can be classified into different subtypes based on their location in the lens and the cause of their development. Here are the main subtypes. Nuclear cataracts. These cataracts form in the center of the lens, the nucleus. They are usually associated with aging. A nuclear cataract can cause the nucleus to become more dense and can change the eye's ability to focus. One of the early symptoms is often a temporary improvement in near vision, known as second sight. Cortical cataracts. This type occurs in the lens cortex, which surrounds the central nucleus. Cortical cataracts are characterized by white, wedge-like opacities that start in the periphery of the lens and work their way to the center in a spoke-like fashion. They are commonly associated with diabetes and cause problems with glare and light scatter. Posterior subcapsular cataracts, PSC. These form at the back of the lens, right in the path of light on its way to the retina. PSCs can cause significant glare and vision problems under bright light conditions. They often develop more rapidly than other types and are frequently found in younger individuals, as well as in people with diabetes, high myopia, or those taking high doses of steroids. Congenital cataracts. Present at birth or formed during childhood, these cataracts can be genetic or associated with intrauterine infection or trauma. Some congenital cataracts don't affect vision, but others need to be removed to prevent visual impairments. Secondary cataracts. These cataracts develop as a result of other medical conditions, such as diabetes, or exposure to toxic substances, certain drugs, like corticosteroids, ultraviolet light, or radiation. Traumatic cataracts. These develop after an injury to the eye. The cataract may form immediately after the injury or several years later. Each type of cataract may have distinct symptoms and progress at different rates. The treatment, which typically involves surgical removal of the cataract, is similar across the different types. Regular eye exams are important for detecting these subtypes early and managing them effectively. The primary treatment for cataracts is surgical removal of the cloudy lens, which is typically replaced with an artificial lens. The decision to proceed with surgery depends on the degree to which the cataract is impairing vision and affecting daily activities. Here are the main treatment options for cataracts. Cataract surgery. The standard treatment for cataracts is surgical removal of the cloudy lens. This procedure is typically performed on an outpatient basis and is one of the most common and successful surgeries in the U.S. The surgery involves the following steps. Phacoemulsification, the most common technique where a small incision is made in the side of the cornea. A tiny probe is inserted, which emits ultrasound waves to soften and break up the lens so it can be removed by suction. Extracapsular cataract extraction, used for advanced cataracts where the lens is too dense to dissolve with ultrasound. It involves a larger incision to remove the cataract in one piece. Intraocular lens, IOL, implantation. After removing the natural lens, it is usually replaced with an artificial lens called an intraocular lens, IOL. There are different types of IOLs available. Fixed focus monofocal. These lenses provide clear vision at one distance only, far, intermediate, or near. Multifocal. Designed to provide clear vision at multiple distances. Accommodating. These lenses can move or change shape inside your eye, allowing focusing at different distances. Toric. Used for patients with astigmatism. Postoperative care. After surgery, patients may need to use eye drops as prescribed and wear an eye shield or glasses for protection. Recovery is generally quick, with most people resuming normal activities within a few days. Non-surgical options. In the early stages of a cataract, the following non-surgical treatments might help: updated eyeglass prescription, stronger bifocals or other prescription lenses. Anti-glare sunglasses, to reduce glare sensitivity. Magnifying lenses, for better close-up vision. It's important to note that cataract surgery is recommended when the cataracts interfere significantly with daily life. The procedure's timing is largely dependent on the individual's specific situation and the severity of vision impairment. Regular consultations with an eye care professional are crucial for monitoring the progression of cataracts and determining the appropriate time for surgery. While no diet can completely prevent or cure cataracts, certain foods are believed to be beneficial in reducing the risk of their development and slowing their progression. These dietary choices are generally rich in antioxidants, vitamins, and minerals. Here's a list of foods and nutrients that are often recommended. Fruits and vegetables rich in vitamins C and E. Antioxidants like vitamin C and E are known to protect the eyes from oxidative stress, which can contribute to the development of cataracts. Foods like citrus fruits, berries, peppers, tomatoes, and leafy greens are excellent sources. Omega-3 fatty acids. Found in fatty fish like salmon, mackerel, and sardines, omega-3 fatty acids are believed to promote eye health and may help in preventing cataracts. Whole grains and fiber. Diets high in refined carbohydrates may increase the risk of cataract formation. Opting for whole grains like brown rice, whole wheat, oats, and quinoa can be beneficial. Nuts and seeds. These are good sources of vitamin E and omega-3 fatty acids, both of which are important for eye health. Legumes. Beans, lentils, and other legumes are high in fiber and have a low glycemic index, which can help in managing blood sugar levels. This is especially important as diabetes is a risk factor for cataracts. Water. Adequate hydration is essential for maintaining the health of all cells in the body, including those in the eyes. Foods rich in lutein and zeaxanthin. These carotenoids, found in egg yolks, spinach, kale, and other leafy greens, are important for eye health and may reduce the risk of cataracts. Limiting alcohol and avoiding smoking. Excessive alcohol consumption and smoking can increase the risk of cataracts, so moderating alcohol intake and avoiding smoking can be beneficial. A balanced diet that includes these elements, alongside regular eye examinations, can help maintain overall eye health and may reduce the risk of developing cataracts. However, it's important to note that diet alone may not be sufficient to prevent or treat cataracts, especially if they are due to aging or genetic factors. Regular consultations with healthcare and eye care professionals are essential for appropriate management. In conclusion, it's important to remember that behind every statistic and scientific fact, there are real people with their own stories, struggles, and triumphs. Cataracts, more than just a medical condition, can profoundly impact a person's life, affecting their independence, their enjoyment of the world, and their connection with loved ones. The journey through cataracts is not just about the clouding of the lens. It's about the resilience and courage of those who face this challenge. It's a reminder of the preciousness of sight, often taken for granted until threatened. Every blurred image, every faded color, speaks to the urgent need for awareness, early detection, and effective management of this condition. Let this video serve as a call to action. A reminder to cherish our vision, to seek regular eye examinations, and to embrace a lifestyle that supports eye health. For those dealing with cataracts, know that you are not alone, and that modern medicine offers hope and a path back to clarity. To those who haven't experienced this journey, let's extend our understanding and support to those who have. And let's all commit to raising awareness about cataracts and the importance of eye health in our communities. Together, we can illuminate the path for those walking through the haze of cataracts, guiding them towards a brighter, clearer future. And remember to be kind to your body so that it can be kind to you. Thank you for watching this video to the end, and I hope you learned something new. Please do not forget to like, share, and subscribe. I wish you a very beautiful day and a healthy life. See you in my next video.